So, Stephanie, when it comes to patient identification, what kind of issues are we seeing from our member organizations?
Actually, Paul, we're not seeing one specific issue. The issues can occur throughout a patient's hospitalization, anywhere from registration all the way up through discharge of the patient. Some examples are in registration, two patients have similar names, they're registered under the wrong patient. A father and son, they've been previously treated here, they'll register the father under the son's name, anything like that. In lab or radiology, the physician or provider can order the test under the wrong patient. Sometimes the wrong patient is taken down to the test, up to even the results are put into the wrong patient's chart. Medications also can be ordered under the wrong patient or given to the wrong patient, even up to the discharge of a patient where patients receive the wrong discharge orders.
So why are these kinds of errors important?
The thing with patient identification is it's not just specific to the hospital. It can occur in the hospital, it can occur in your physician office, even in the community pharmacy. One of the problems too with that is it stays with that, it can stay with that patient for a while. If it's in the electronic record, it might be difficult to get out of that record. And it's not going to affect just one patient, you're going to affect two patients. Now you have another patient who doesn't even know that the wrong results or wrong test and information is in their chart.
So what kind of things can a healthcare organization do to help limit the risk of patient ID errors?
One of the things that most hospitals do have in place already is a policy and procedure to use two approved patient identifiers. One thing that they need to do is make sure that that practice is actually being followed and look at what their identifiers are. And remember, room number is not a patient identifier because that's not going to be unique to that patient. Another thing is to have the patients actively involved, in the identification process. Tell the patients, I'm here to give you your medication, what's your name and what's your birth date. And one of the reasons too behind explaining it is because sometimes people will be like, why do you keep asking me the same questions? I know who I am and I know what my birth date is. So explain to them why you're doing it. And a lot of places have signs up. You'll see them where it says, did I identify you? Just to let the patients know that if somebody doesn't identify you, say, why didn't you? And, why didn't you ask me my name and birth date?
Great, thanks, Stephanie.
Thanks, Paul.